there, guys. Welcome back. Thanks for tuning in. And again, hit the like and subscribe button. Leave your comments below, whether you like it or hate it. And I want to talk today about mainstream media, and in particular today, about the CBC. I think they're full of misleading content, many of the news that they give us today, and they like to have biased spokespeople that they call on their opinions. They're so-called professionals. They have ulterior motives, and they think that these people are suitable to call on for their opinion. Well, of course, they're going to give the opinion of whatever narrative they want to spin, and that's who they look for. They won't find the average person and ask their opinion. They're going to ask the opinion of the person that's going to send the message that they want to create. Here's an interesting little misleading one that I found the other day, and I'm going to play a bit of it here, and then I'll talk about it here after. So, and here it is.
Alberta already has one COVID field hospital, which only came into use this fall. But with hospitalizations and ICU capacity stretched, and in some cases overflowing, tonight it's asking for help so that it's ready to build more. As CBC News first reported, Alberta has asked the Red Cross about providing 2 field hospitals and the federal government about 2 more, if and when existing hospitals are overwhelmed. The Premier says it's for contingency planning, not needed immediately.
While there are about 16 hospitals,
and that's right. So they're not being staffed, the field hospital that we do have, and they're going to say right away here how they actually didn't really ask for anything yet.
Given the new cases in the last few weeks.
Public Safety hasn't received a formal request from Alberta yet, or any other provinces and territories. Both federal and provincial sources say discussions.
So that's right. So they haven't actually asked for anything yet. But here's their expert.
Hospitals. A concern to those who have been raising alarms about healthcare capacity.
I do have concerns about our ability to staff 4 field hospitals in the province. We are already very stretched thin with the staffing we have available for the hospitals that we have right now.
There is some flexibility left in the healthcare system by canceling surgeries, for example, and redeploying qualified staff to COVID care.
So
but the bigger concern from some doctors.
So that woman that they had there talking about her concerns, the ICUs are full. Yes. But our ICUs are never empty. In speaking with some other healthcare professionals, like one that was at a rally that I was at last weekend, they're not empty, the ICUs. But one of the things that she did mention was that AHS policy is that, when their staff are in contact with patients that test positive for COVID, they're isolated and they're not able to work. So, I would say that does pose a problem, but that's not a problem that is due to COVID filling the ICUs. And that's the message they want you to take away, is that this pandemic is so bad that the ICUs are now full. Well, I'm not denying that there's probably a few patients in the ICU. And I'm actually going to try and pull up those numbers here a little bit later as well. And let's have a look at exactly what those numbers are, because they are available. And you'd be surprised. I know earlier in the month, the numbers were really low. There was about, I think, back closer to, in November, I saw some stats that were around 8 people in ICU in Alberta. That's not a lot when you consider, our entire province. Now, I'm not saying that right now those numbers aren't a bit higher. I'm going to try and dig up that information for you here in a few minutes. But Um, it's clear that the CBC wants to spin their narrative, so they pick people like, well,
Is what expand.
like this woman here. So that Shazma woman, I did a little bit of digging and found her on Facebook. So here's a couple of her posts. Now, I don't know how legible that is going to come through, but one of them is she likes to post things on her Facebook trying to fearmonger people. So here's one. We need to smarten up, Alberta. Listen to the public health advice and keep everyone safe. And she's reposted a post from one of her friends on Facebook. I blacked it out there. And lost my first patient to COVID. They were 37 with no relevant comorbidities. Okay. No relevant comorbidities. So who's considering the comorbidity relevant? And what's a relevant morbidity? Sorry. So that's an opinion. Here's another one. Please share widely. Here's how much she loves Premier Kenney. The UCP wants to privatize our healthcare system because all they care about are profits, not the health and well-being of Albertans. It's right here in black and white. In a previous AGM, the members already voted in favor or opting out of the Canadian Health Act. This is the act that protects every Canadian's right to free and accessible public health care, and they want to opt out? And it goes on there. But she's talking about... she's in a nutshell, she's bashing Kenney and the government some more. Here it is, her last one here, and if you go on her Facebook, it's full of conservative, anti-Jason Kenney rhetoric. She's pro-union, really hates the fact that the Kenney government has made some cutbacks, and now they're short-staffed and they're hating it. And hey, I know what it's like to work long hours. I've been there before. I think many people know what it's like to work long hours. But this isn't Jason Kenney's fault. This is, AHS's issue with, some of their policies and how they're creating an issue of being short-staffed. So here's another post that she makes. The man who demands you take personal responsibility refuses even the smallest measure of it for himself or his government. It was Premier Kenney who decided we should wait until our hospital system was strained to consider more actions to prevent transmission, and when everyone questioned this approach, the Premier's army of issues managers were quick to ask why they didn't trust the province's chief medical officer. It's time to knock it off and take some personal responsibility, Premier Kenney. I could go on and I could find a million more posts like that. Her Facebook's full of them. So that only took me 2 minutes, CBC, to figure out that she's anti-conservative government and anti-Jason Kenney. Great pick, though, for somebody to speak on your hit piece, which is one of a million against the Kenney government. But we won't go down that path. Anyway, it's just one example of many of a biased media, biased articles by the CBC, and how they hate conservative governments everywhere. And guys, you don't have to take my word for it. Just do a little bit of digging, and every time the CBC has some professional spokesperson on speaking about COVID or any other issues that you're concerned about, just look them up on social media. It only takes usually 2 seconds to figure out whether they have a biased opinion, because most people are pretty outspoken on their social media. And I'm not saying that I'm not biased in some aspects. For sure I am, but at least I like to look at some of the numbers. And some of the numbers here on COVID, which I'm going to bring up here in a second, don't make any sense to me. And the lockdowns don't make any sense either, in my opinion. And that's, again, and I'm about as qualified as Bill Gates, actually. So here it is, guys. I pulled up some of the data for confirmed cases and confirmed deaths from around the world. Check it out here on ourworldindata.org. You can pull up all kinds of information. This is a 7-day rolling average. Tests per case, confirmed cases, confirmed deaths, case fatality rate. You can just click on whatever country you want, and it'll give you all their stats. These are sourced from the Johns Hopkins University. It's their COVID data. Anyway, so I wanted to talk about a couple different things. So we talked about masks are a big hot topic right now, and the death rates. Everybody's dying of COVID. There's no active cases do not equate to deaths. So let's get that. I mean, I've noticed that the mainstream media have stopped talking about deaths, and they're talking about all these cases. And let's face it, the stats and the numbers on this don't lie. If you get COVID, this does not mean you die. So yes, you may get sick, but this does not mean you're going to die. So let's look at some of the numbers from different countries in the world here. So I've got confirmed cases. Now, a really interesting thing here is I brought up, I've also added a country from South America here in here. I added Chile on here. And if you notice here, this starts back in March 17th. They had a spike here in, June 13th. I wonder what we were having here. We were having summer. Yes, that's right. We had summer here, and they were having their winter down there. And then their cases dramatically dropped. And then here in October, November, we have these big spikes in our Western countries, our countries here in the Northern Hemisphere. And if you look here, well, look, the Netherlands, and you have Poland, you have Sweden and the United States. Now, these are just confirmed cases. You have Poland here. So so in Sweden, they did nothing, and they kept their economy rolling. And in countries like Poland had some extreme mask requirements. I believe they were even actually required to wear masks at one point at home, in their home. So from what I've heard, that's about as extreme as it gets. Now, for some reason, Poland's infection rate and confirmed cases is higher, and this is these numbers are all cases per million people. So you have about, it looks like on the chart, nearly 700 cases per million. I think 676 is what it says on the thing. And the Americans never even got up that high ever at all. So, and here in Canada, we're at about 170 is the 7-day average for cases per million people. And somehow in Chile, in our winter, they're having a pretty low number. It's kind of flatlined after in the end of their winter, and kind of died off and fizzled out. Let's look at confirmed deaths. Let's look at this. Oh, wait, look, here early on, we had some confirmed deaths, apparently, although, some of those are, questionable. But we had here in the winter, tail end of winter, everything drops off. And wow, in South America, when they're having the least amount of sun, least amount of daylight here in South America, their death rate is fairly high. You see this spike here in our summer and their winter. And in our summer, oh wow, look, the numbers dropped and declined drastically. And then here, wow, in Poland, we have a massive spike in deaths in a country that has some of the strictest mask laws and mask requirements. So much for the theory that wearing masks equates to reduced risk. So I'm going to go ahead and take that down now. Anyway, it's the website is ourworldindata.org. So one of the takeaways from that I get is, I mean, masks don't seem to correlate to reduced numbers, reduced percentages of infection. That doesn't seem to work. Even strict countries like Poland have a high infection rate, much higher than countries like Sweden, where there's a very low infection rate. So, it's not very low, but it's significantly lower than countries like Poland. And then you have areas in the United States, even within the United States, where, like Florida as an example, where people are getting lots of sunshine, despite the fact there's a lot of elderly folks in Florida, but for some reason their infection rates are really low. So what do I attribute that to? I would say is sun. Clearly, this virus is worse in the winter. And now we're telling all of our citizens to stay indoors, don't get sun, don't go out, don't be healthy. We're closing down gyms. I think that's the wrong strategy. And Jason Kenney, if you're watching, you are a coward for falling for all the media crap and the rhetoric that many of the AHS folks are spinning out there in social media and attacking you. Stay strong and we'll support you. If you don't, well then I, as a conservative, I can't support your foolish ideas. So if you look at the numbers, you look at the fatalities, you look at the deaths out there, the numbers are really low, man. So anyway, I'm going to leave it at that. You can't argue with the numbers. You can't argue with the charts. The numbers are all there, guys. I encourage you guys to go and look at them. Have a look for yourselves. It's all out there. You just need to take some of that personal responsibility and actually go out there and look for yourselves. Instead of listening to CBC and all the mainstream media crap, CTV, Global, you can find all kinds of BS lies in most of their reports, unless it's about puppies or something. But anyway, when it comes to this COVID stuff, the media is lying to you guys out there. So just take some responsibility, have a look, follow up, check some of their sources and their people that they actually have, their so-called professionals, and make sure they're not offering a biased, one-sided opinion. And take personal responsibility for yourselves. Hey, it's not my responsibility to protect you. It's not my responsibility to put on a mask and save you. It is your responsibility to protect yourself. If you're at risk, buy a good mask, one that works, not a paper piece of crap that you can wipe your ass with. Piece of toilet paper works just as well, according to Theresa Tam, that crackpot. But anyway, buy yourself a good mask. Make sure you're clean shaven if you're a guy. Get yourself a decent mask and protect yourself. I got no issues with that. But guys, it is not my job, nor will I make it my job to look out for you. If you make it my job, I will slap the cigarette out of your mouth. I will take that cheeseburger and knock it out of your hands. I will, pull that bag of chips out of your hands at the grocery store. Do not make it my job to look out for your health. It is not my job. It is your job. Take responsibility. Put the chips down, go out for a walk, go enjoy some sunshine, go spend time with your family. That's what you should all be doing, not locking yourselves away and listening to the panic and the garbage that the mainstream media is telling you. Because clearly the numbers just aren't there. They're not there. And up until a little while ago, And I'm just kind of curious as to why, they're not resetting the numbers on the whole COVID thing, and they're not, cutting those numbers in May like they do with influenza, because clearly this virus behaves very similar to influenza, and we're going to have a season for it. But I don't think COVID is going anywhere. And I don't think it's going to disappear no matter what we do, masks or no masks, lockdowns or no lockdowns. I think it's going to be around for a while, just like the flu and the common cold. So anyway, with that, folks, I'm out. Have a great day. Anyway, guys, thanks for tuning in. If you like the show, please subscribe, hit the like button, hit the notification bell, and leave your comments below. That's how YouTube does its thing. So make sure you subscribe and hit that like button. Anyway, we'll see you guys tomorrow.